Hello, this is Melanie Huff, and I would like to present a topic that I think is very interesting and still up and coming. I have had the pleasure of working with multiple sclerosis patients for the past 3 years now, and I became an MS certified nurse in the summer of 2015. The complexity of the disease fascinates me, and it keeps me on my toes as a nurse and a soon-to-be provider. I love being part of the MS team, and I choose to believe that we have hope for a cure. The topic of my presentation today is vitamin D and its role in multiple sclerosis. So now let's define the issue. My PICO question for this presentation is as follows. In patients with multiple sclerosis, does an adequate vitamin D level compared to a low vitamin D level reduce the symptoms of multiple sclerosis? The normal vitamin D level is usually 30 to 50. Eating healthy and maintaining a healthy body is becoming much more popular. We know that being healthy helps prevent and cure many diseases such as diabetes, blood pressure, obesity, and hypertension, just to name a few. But what do we know about vitamin D and the role it plays in our body? We know it's good for our bones, and without it we could not absorb calcium, but does it also do other things? Well, the answer is yes. It also helps to maintain a healthy nervous system. It helps to regulate insulin levels and maybe even other things. The role that vitamin D plays in the disease of MS is still a mystery, but it appears that it contains some immune modulating potential, and it is important in the role of T cells. Large bodies of research have shown that sun exposure does play a role in reducing the chance and severity of MS, but not many bodies of research have examined the role of vitamin D supplementation. Vitamin D signaling may decrease inflammation and promote the anti-inflammatory response, which would be significant in preventing MS symptoms and possibly changing the disease course. So let's learn a little background information. Multiple sclerosis is a chronic demyelinating disease of the central nervous system. It affects millions of people worldwide. It is believed that your body's immune system somehow becomes activated and that possibly T and B cells begin attacking your nervous system. To date, there's no known cause of this activation. However, we have learned that the environment, genetics, and your immune system play roles in whether or not you will develop MS. The disease attacks the central nervous system and the coating or the myelin of the nerves. By doing this, it disrupts the nerve pathway and causes decreased or no signaling, or sometimes skipped and painful signaling of the nerves. Multiple sclerosis can take many paths once it's activated. Some patients don't experience many painful symptoms, and some have very little disability. Other patients have a very aggressive course that declines from the very beginning and never stops. The life expectancy for someone with MS has grown much higher over the years due to all the increasing research. There are more than a dozen medications now to help prevent future relapses and lesions in the nervous system. This disease is still unpredictable and can cause many troublesome symptoms such as numbness, tingling, pain, headaches, weakness, bowel and bladder dysfunction, spasms, cognitive decline, fatigue, and depression, just to name a few. There's been a lot of talk in the past few years about the role of vitamin D and that it may or may not help in reducing symptoms and relapses in MS. If we have a way to prevent some patients from experiencing some of these symptoms, then we should do our best to research this topic and provide this information to our patients. It's been proven that areas further away from the equator suffer from increased prevalence of multiple sclerosis. Due to research, the physicians that I work with have been instructing MS patients for a couple of years now to keep their vitamin D level on the high side of normal. The purpose of this literature search today was to see the research behind this thought and if studies have proven that it's beneficial for MS patients. To help further understand some of the journal articles that I have reviewed, I would like to explain multiple sclerosis, its disease course, and some of the most common terms used. In the previous slide, we talked a little bit about multiple sclerosis and this common symptoms of MS. It is a demyelinating disease of the central nervous system. To date, there's no known cause of the disease. Years of research proves that our genes, our immune system, and environmental factors seem to have a large role in the development and the course of MS. There are two main types of the disease. There is a relapsing form of the disease in which a person goes through relapses, or also known as exacerbations, and then sometimes return to normal after a short period of time. In 10 years, 80% of these cases, these relapsing cases, will move on to the progressive form of the disease. This is a more steady state of decline. A person with progressive MS can decline to disability very quickly, or sometimes in a slower, steady state. The way to track the progression of disability caused by MS is by using the Expanded Disability Status Scale. This scale was developed in the 1980s and is a 10-point scale that increases in increments of 0.5. If you score a patient with 1 on this scale, they have no disability, and if you score a patient with 10, they have had death by MS. Magnetic resonance imaging, or other known as MRI, is used to help establish the diagnosis and progression of the disease. A person with MS will have demyelination in the brain, cervical, or thoracic spinal cord. Even though MRI can help you diagnose the disease, it doesn't necessarily mirror the symptoms or disability the patient presents with. Some patients with just a couple of lesions may have multiple symptoms, and other patients with more than 30 lesions almost go symptom-free and have no noticeable disability. It is pretty unpredictable. I use the Maryville Online Library, the Sinal database, and the journal articles from my office to complete my research on the effects of vitamin D levels and relapses in MS. I was able to find 3 peer-reviewed articles that were relevant to the topic. The title of these articles are Latitude, Sun Exposure, and Vitamin D Supplementation, Associations with Quality of Life and Disease Outcomes in Large International Cohort of People with Multiple Sclerosis, Novel Modulating Effects of PKC Family Genes on the Relationship Between Serum Vitamin D and Relapse in Multiple Sclerosis, Regulatory Role of Vitamin D in T-cell reactivity against myelin peptides in relapsing remitting multiple sclerosis patients. So let's present some evidence. Research article number 1, Latitude, Sun Exposure, and Vitamin D Supplementation, Associations with Quality of Life and Disease Outcomes in a Large International Cohort of People with Multiple Sclerosis. This article was a survey of over 2,000 multiple sclerosis patients. The survey was composed of 163 questions and was designed to see if sun exposure or vitamin D supplementation had an effect on the disability scores of patients. The researchers used the PDSS, which is the Patient Determined Disease Steps Scale, which is very similar to the EDSS described previously, to determine the level of disability. They hypothesized that due to the immunomodulatory effects of vitamin D, that patients who had more sun exposure and vitamin D supplementation would see a reduced relapse rate and a reduced disease progression. The 3 variables in this study were latitude, deliberate sun exposure, and vitamin D supplementation. The results were pretty astounding in the study. It showed that disability was related to latitude, and the further away the equator they lived, the higher the odds of a higher disability. Those patients that were taking supplementation and that had sun exposure were also noted to have about 1/3 less annual relapse rate. Research article number 2, Novel Modulating Effects of PKC Family Genes on the Relationship Between Serum Vitamin D and Relapse in Multiple Sclerosis. This study was a prospective cohort study that followed 198 patients with multiple sclerosis. These patients lived in Australia between 2002 and 2005. The researchers wanted to know if there was a link between the patient's genes and serum vitamin D that played a role in the relapse of MS. They wanted to know if the PKC, otherwise known as protein kinase C gene, played a role in modulating vitamin D and therefore reducing relapse. They measured relapse rates by phone or review every 6 months. A true relapse was validated by the study physician and study neurologist. The disability was measured every winter using the EDSS scale. A total of 122 relapses occurred during the time of this study. Results. They were able to show that several genes potentially work together to possibly influence the level of vitamin D in our body and the hazard of relapse. The PKC gene, along with many other genes, may play a role in the modulation of vitamin D in our body. I don't think it's necessary to go into all the names of the genes at this point. The takeaway from this data, though, is that there needs to be more research on the genes that play roles in our body's level of vitamin D. This is important to us as clinicians and should be further researched. We are learning that vitamin D does have a role in MS and its disease course, however, in this article. We are under the assumption that this can be modified or helped by supplementation, but if a patient has a gene deficiency or a problem, then supplementation could possibly not even matter. Research article number 3, Regulatory Role of Vitamin D in T-cell Reactivity Against Myelin Peptides in Relapsing Remitting Multiple Sclerosis Patients. This was a direct study in which 95 patients from Spain were involved. From these patients, 40 were relapsing remitting, 15 of them were progressive, and 40 of them were controls who did not have MS. The main goal of this study was to compare the vitamin D levels of those with MS to the vitamin D levels of the control patients. Blood samples were taken from each patient during 2 months in the winter and during 2 months in the summer. The results were different depending on the season. So during the winter, vitamin D levels were significantly lower in the relapsing remitting patients compared to the controls. Interestingly enough, the progressive MS patients did not show much difference in their levels when compared to the controls. And neither group showed much difference against the controls in the summertime. This tells us that during the summer months, MS patients, their levels of vitamin D are very similar to control patients, but for some reason in the winter months, they're more deficient in vitamin D. I could very well have something to do with the direct sun exposure in the summertime. But in the winter, I wonder why MS patients don't maintain vitamin D levels just like the controls do. I would be very interesting to see more research on this topic. Some of the critique of the evidence that I found. There are some notable limitations in these studies. 2 of the studies were small sample sizes, one with a total of 95 and another with a total of 198. Another limitation is that when researching the effects of vitamin D on MS, you're limited by the number of peer-reviewed studies and articles that you will find. To this date, there have not been enough studies to prove how effective it truly is. As one study suggests, the level of vitamin D were not any different in the groups during the summer than the control group. This information needs more research to determine why MS patients are able to hold their vitamin D levels stable in the summer. My guess, like stated previously, is that because people spend more time outdoors and get more sunlight in the summer. Lastly, it's difficult to really determine whether or not vitamin D is the cause of relapses or progression of disease. There are many other variables that could be contributing to relapses, such as a person's genes, their environment, their other comorbidities, and the baseline course of their disease. Not knowing what causes MS makes this even more challenging, as these causes and effects could be different for each patient. There were themes across the studies, though. The main theme is that although there's more data that needs to be collected on the exact role vitamin D plays in MS, the evidence is pretty overwhelming. It's noted in all three studies that for some reason, patients with MS have less disability when they have adequate levels of vitamin D. Because there's no harm in maintaining a good vitamin D level and there's some positive evidence, we should go ahead and encourage our patients to monitor this on a regular basis. Some foods that contain vitamin D are seafood, fish, milk, cereals, cheese, and butter. Supplements of vitamin D are easily bought over the counter and can be taken on a daily basis. Findings in my own practice. I have been working with MS patients now for 4 years. In my experience, the talk of vitamin D and its possible protection against disability is becoming more common, but not consistent. In my clinic, we do check patients' vitamin D levels on a regular basis, at least yearly. And depending on the patient's level of vitamin D, we will encourage them to continue their current supplementation, either increase their supplementation, or sometimes take a high-dose supplementation for 8 weeks. One of the major problems that I see is that patients forget after taking the high-dose supplementation to have their vitamin D levels redrawn, and they forget to resume their normal daily supplementation after that. So all of that work is really not helpful if their levels are not going to stay in the normal range. I think the evidence is substantial enough to educate patients on a more regular basis and to monitor their levels on a regular basis as well. Education needs to be done to teach patients the possible importance of the supplement, the way to maintain their levels, and how to monitor their levels. Feasibility and barriers to change. I believe that feasibility and barriers sometimes go hand in hand. The feasibility to change current clinical practice should not be difficult for most clinics and patients, but it's a change in the way that we do practice. It really only requires more consistent education and the monitoring of vitamin D levels. Most neurology clinics are checking vitamin D levels already, but have not developed a routine or a consistent way to monitor the levels. Patient compliance is always an issue when it comes to any healthcare improvement. We need to do our best to provide the information that is available and give the patients the tools to make good informed decisions and take charge of their health. Key findings. After doing this research, it's clear that vitamin D does seem to play some neuroprotective role in MS. The study data is limited and needs to be further researched, but overall it's so far overwhelming at showing it does decrease relapse and can prevent future disability. We have the tools to educate our patients about this and show them that it may be beneficial to their disease. MS patients should maintain a healthy level of vitamin D and even encourage their children to also have a healthy level to maybe prevent future MS in our children. Thank you for listening to my presentation today, and hope you enjoyed it.